my personal situation as a recovering drug addict, 32 years, progressive, has equipped us in the ARP department, because we're all recovering, to identify with what's going on with them. So pretty much all life situations that a patient has been through, I can relate to because I've been through it. So it's very beneficial and important to the patient to have a counselor who understands and has basically walked in their shoes.
All of our counselors that we have, we're all in recovery. Some of us did go to treatment here and some went elsewhere, but I think it's extremely important. And it immediately puts the patients at ease when they realize that where they are now, that their counselor's been there and can kind of help them and guide them through the treatment process. So I think that's extremely important.
I also like to think of the recovering staff as examples of what recovery is, and we come from all walks of life, you know, and it doesn't always mean a lot of money. It doesn't always mean a happy relationship that's long-term or whatever. Each person is different about what recovery looks like, and we've got all kinds of examples. And we're really trying to introduce people to a sober way of living, and that means a lot of changes. And if it doesn't look attractive to the person who needs to get clean and sober, well, they won't want to. Recovery doesn't have to be dreary. You don't have to be miserable. We call that being a dry drunk. There's ways to find that happiness and that peace.
Sometime during the day they'll have group therapy again to build on some deeper self-evaluation, to really talk about what's going on from an emotional standpoint and try to connect to their past to see that current coping skills and attitudes and perceptions have been influenced to a degree that they're not aware of, because we're so automatic as humans. We're really reactionary, and so group therapy is a way of them kind of getting in touch with the past so that they understand what's going on with them presently.
I tried it my way and it didn't work. Most of the people that walk in these doors will tell you that. My way didn't work. I've got to try something else. It may take them 10 days to realize that, but that's okay too. Not everybody, the old saying is, not everybody got here because they saw the light. It's because they felt the heat.